Legal marijuana sales began late last year in New York, but that doesn't mean any store that wants to sell the drug can do so.
Yet thousands of illicit businesses in New York City have been selling illegal pot for years, and New Yorkers continue to buy from them, which could be dangerous.
Yeah, well, joining us now to talk more about it this afternoon, Adam Birkenstock, Director of Programming for the Long Island Council on Alcoholism and Drug Dependence. Thanks for being with us this afternoon.
I'm glad to be here.
So we first want to address and talk about those illicit non-tax businesses that are selling pot. Now that dispensaries are open and they're legally selling out there, how can people tell if what they're buying is illegal and potentially dangerous?
It's a great question, and I think it's a harder question now than it's been in the past because there's a confusing market out there. There are ways for people to tell, so dispensaries are supposed to have a sign in the window that's given by New York State. There's also supposed to be 3 specific symbols, so one indicating that there's THC in a product, one indicating that you need to be over the age of 21 to buy it, and one indicating that it's been tested and verified by New York State if that product is available to be legally sold.
Okay,
so those are things that people have to look out for.
Okay, so Adam, there are now 2 dispensaries up and running in the city, but there are dozens on the way. So what do you think it will really take for people to move from buying from a legal market to the more regulated markets?
That's the, no pun intended, the million-dollar question, because I think the biggest issue that we're facing is one of cost. In order to run a legitimate business like this, it does cost more money. And I think one of the reasons you see a flourishing illicit market like this is because it's cheaper to get it illegally, but it comes with such a high risk. And one that I don't want to overstate is that most of the people that we're talking about who are at risk are young people under the age of 21 who are looking to buy this because they didn't have access in the first place. It costs money to run a business where the testing is done well, where the producing is done well. But even if the producing is done well, that risk of addiction is still there. It doesn't necessarily risk you running into things like salmonella and E. coli, but the risks of contamination are something that kids really need to be aware of when they're looking at products.
So we've had several incidents in the New York City area in particular where students had to go to the hospital after smoking or vaping what they thought was only marijuana. In fact, in November, New York Medical Cannabis Industry Association reviewed pot products from 20 illicit stores out there. 40% contained a lot of harmful contaminants like E. coli, lead, salmonella. So is there a way to tell if the illegally purchased marijuana has any other dangerous substances or things that are added to it?
The sad answer to that is no. There are drugs that when you buy them, however you buy them, there's a way to test. My organization hands out fentanyl test strips to people who are using heroin, and we instruct people on how to make sure that if you're going to make the choice to use this drug, try to make sure there's not fentanyl in it. But we're talking about things like salmonella. We're talking about things like lead and heavy metals. These are risks that you can't just look at the marijuana and tell what's in there. So it's hard to avoid that kind of risk. And unfortunately, when you build a new market like this, a legal market on top of an illicit market, you see this kind of boom in the illicit market. And it certainly makes me nervous as a health professional.
Let's talk about another boom. New York City public schools have reported a spike in the number of students actually caught with illegal drugs or alcohol, especially among middle school students. So now that marijuana is legal, do you think this problem will actually continue to grow?
100%. And we've been seeing it for a few years, really throughout New York, but I can speak to my home region of Long Island. We talk to schools and to students and parents in schools all across Long Island, and we've been seeing this trend for a while. And something I hear a lot from students is, well, if it's legal or if it's becoming legal, then how could it be bad for me? That perception is one that it's really important to push back on, that legal doesn't necessarily mean safe, and safe doesn't necessarily mean it's the safest choice for someone to make. So helping kids understand what is the healthiest choice, how to make healthier choices is something that's really critical in this juncture.
So I'm curious, is there anything that these schools can try to do and fix this problem, since that's where kids spend the majority of their hours?
Definitely. I think partnerships with different community organizations can be a huge help. kids are facing all sorts of issues nowadays. I mean, mental health has always been a struggle for students. There's a reason that people turn to marijuana, right? I always joke with people that, especially young people, you didn't plan to spend your afternoon talking to me. I'm sure I'm very exciting to my friends, but you're not looking to spend your afternoon here. You want to play Fortnite, you want to be with your friends, but you're here because you've run into trouble with marijuana or other substances. So making sure kids have community activities to do, and it's something that I think New York City schools do really well, but it's important to focus on making sure we're investing time to educate our teachers and our social workers in schools, our guidance counselors on the risks, how to notice them, how to recognize those products and the use that's going on inside of our schools.
So, Adam, some parents may think my kid is going to try marijuana. I'd rather they do it under my supervision, so I know their say. What do you say to them?
Yeah, it's an old story, I think. I've heard this a lot from parents. I hear this with alcohol. I've heard it with other substances too. And my advice is the same, which is your house can be really a sacred space for your child, even if it can feel like, whether you have a toddler or a teenager, that they're just looking to break the rules all the time. By setting up the expectation that here are the rules, here are the expectations, this is a safe and healthy place for you, you let them know that they have that safe and healthy place. So even if they come and say, well, you know, John's mom lets him do this, my other friend's mom lets him do this, that's not what happens here. So they have a place they know is a place to go for help. And I was actually talking to a coworker in the same field in prevention, and she said she's done all this, gone through all this with her child, and her kid came to her, he's 20 now, and said, Mom, I realized that you were just showing me how much you care, and there's so many kids whose parents don't seem to care about them. So it's a message you can give your child.
Yeah, safety is really important for people to feel safe, kids especially. Well, Adam, thanks for joining us this afternoon. We like when you're sitting here with us in the afternoon, so we appreciate it. Thanks for being here to talk about it. Of course. And for more information on cannabis regulations in New York, go to cannabis.ny.gov. And if you need help addressing drug use or addiction in your family, visit licad.org.